Hey guys, good morning. This is Dr. Brenden Cochran from Interactive Health Clinic. I wanted to try to go over basically some tips and tricks you can use. I know there's a lot of fear going on right now with this virus going around, and there's some things you can do to prevent some complexities, and there's some things that you should not do because it could increase your problems. First of all, if you're a patient with us, you follow us, we are offering uh, telehealth visits, so to continue your need. We still are currently open, but to let you know some of your fears where we're doing social distancing, social isolation, we do have phones and telephone, or we have in video communication that we can have visits with you during the clinic to support you throughout this process. So one of the things that's going on that we're kind of seeing that have come up recently is what we did learn recently is that a lot of people are asymptomatic carriers, and this can be even up to 50 to 75%. So what this means is people are actively carrying this virus around and they don't have symptoms and they can infect other people. Thus, the reason for social distancing is we don't know who's carrying it. We don't know who's spreading it to other people. And depending on their immune health, they may get signs and symptoms that are mild or they may get them very severe. So that's one of the reasons we're putting into effect, nationwide, you're seeing social distancing is happening currently. So that's very concerning for a lot of people, obviously. The other thing we're learning about this is if you are infected with the coronavirus or COVID-19, that it's really important if you are getting a fever, and we talked about this a lot, functional medicine, naturopathic medicine, not to suppress that fever. And that is really critical. So we found NSAID medications, this is ibuprofen, naproxen, some aspirins, when you are mounting a fever will actually cause the virus to get more aggressive and last longer. And the reason for this really comes down to when you suppress a fever, you suppress a lot of activity in your immune system, such as sequestering certain minerals that viruses use to replicate, such as enhancing enzymes that allow your white blood cells to start to attack and quarantine the virus. Your fever does that. So fever is healthy to a certain extent. Now, your fever gets up where it's 104, 106, that's concerning. Your brain doesn't like that information. So we don't like fever to get that high. So you're asking, what should I do? I feel really crummy, and what should I take? Well, bottom line is you should take things to ameliorate the symptoms. So what this looks like is cold cloths, ice packs under the armpits, ice packs on the buttocks, ice packs on your neck. Take a tepid bath, cold washcloths, popsicles, something to basically cool you down but keep you comfortable. But do not take the medications to suppress that fever. This is really important. Research is coming out of Italy and France for this, that people that suppress that fever, mortality rates increase and severities increase. So that's number one. Number two, steroids or immune suppressant drugs is also putting people at increased risk. So if you are on those things, you really need to be socially isolating yourself from people because you are already at higher risk. If you have a doctor who does not know this and you are put on those things, however, you really want to shy away from steroids, as those steroids, again, are going to suppress immune function and they can ramp up this infection. Third thing, if you do get a cough, the biggest thing with a cough that's important is if you are coughing, some of that cough is good because it keeps fluid from settling in the lungs. And that's when you get pneumonia, right? Because fluid's in the lungs and things can grow in the lungs. So one of the things, we want to have some cough. Obviously, a cough that is violent can cause you to vomit or have lots of pain and lots of issues. So we don't want it to get that severe. and we also want you to be able to sleep. So we need to manage the cough with that. So my other key thing is do not suppress the cough excessively. You want some cough to keep the lungs moving. You need to sit up, you need to breathe. You do not want stuff dropping in the lungs. So that's really critical. A final bit of information to protect you, things not to do, is if you are on medications like ARBs or ACE inhibitors, these are often for blood pressures. Lisinopril or losartan are examples of those medications. We have a very strong suspicion that if you're on those medications, it may upregulate a receptor site called ACE2, and the virus tends to bind to that ACE2, and that ACE2 is the route of entry, basically, and the route of bad things happening in the lungs. So one of the strategies that we're going to be working with our patients is how do we transition off those. Now, if you're already on those medications, please do not stop that medication abruptly. If you stop a ACE inhibitor or ARB, we don't want your blood pressure skyrocketing. So you really need to work with your health practitioner or give us a call if you need to taper off of those. So that's ARBs and ACE inhibitors. Lisinopril or losartan, anything with the sartans at the end of them are examples that could possibly make this a worse situation. So ARBs, ACE, steroids, NSAIDs, bad idea. If you get sick, stay away from those. Those will make things worse. Things that we want to do proactively. We want your immune system to be tuned up as much as possible, guys. So, and it should be like this all the time. So biggest things that we're recommending is zinc, vitamin C, elderberry syrup. There's also lots of mushroom extracts are very healthy for you. So those are some of the things that we can be taking to help boost your immune system. And it doesn't have to come from supplements. You know, most vitamin C you're going to find is actually in broccoli. It's not oranges, right? You don't need that extra sugar. So broccoli, for example, has a lot of vitamin C in it. Zinc, pumpkin seeds have a lot of vitamin C. So if you're running to the stores, you don't have anything, use foods, functional foods, guys. Mushrooms also help as well. Echinacea is another one that you can take. So these are all things, elderberry that I talked about, they're all things that you can be taking and you should be doing ahead of time. Ramp that immune system up. You want that firm immune system. If you do that, bug tries to come in, you're more likely to fight it off or keep it from becoming this big severe thing. Okay? Another thing is, I disagree with the recommendation of not using masks. One of the problems, and may get some flack from people for this, that unfortunately the government's saying masks don't do anything. I totally disagree with that. Let me explain that. Even covering this area is helpful. If somebody sneezes, somebody coughs, and you're in the vicinity of 6 feet, you're getting a massive load of virus hitting you at once. Your immune system is going to react a lot stronger to that versus if you have a mask on and say only get a smaller amount of those viral particles, then it gives your immune system some time to tune up, right, and get used to this. So viral load that hits you depends also on how vigorous and how much you're going to have to deal with this. So if you don't have masks, at least do something to cover. If you have to go out in public, it does have some benefit to that. I know masks are kind of shortage. Personally, I feel like we've dropped the ball. We aren't doing testing. We aren't doing masks. Testing has to be going on. It's not just with people that are having a fever of over 103. The reason that's the recommendation right now is we just don't have enough test kits, guys. So if you call any medical facility, they're only testing you if you're a healthcare provider, or you've been exposed, or you have a fever. We just don't have the kits. We got to get the kits up because, again, 50 to 75% of these people, we're walking around, we're asymptomatic, and we're spreading this to people. So the only way we get a handle on this is testing. We saw that in Taiwan, and we saw that in South Korea. That's how they're controlling it, is testing is crucial. So whatever you got to do, push your area, push your community, push your governor, push the president. You got it. We got to get tests. Final thing is PPE, gowning, eyewear, stuff like that. We're having problems right now in the healthcare industry. We have shortages of these. So it's going to affect how many people can get care because we can only see so many people. You want to keep yourself out of the hospital. Bottom line, you want to keep yourself out of the hospital. They are not going to have enough beds and ventilators to control this. So the biggest thing you can do, social isolation. Keep your immune system ramped up. Wash your hands frequently. Really, those are key things that have to be done to keep you out of the hospital. The hospital's getting overwhelmed, okay? I have colleagues, an ER doc, unfortunately, he's in critical care. An ER doc I know up in Toronto, they're overwhelmed, they're running out of PPE here. This is critical to get around to people because, you know, we're testing everybody in the staff. I did my test earlier this week. Everybody here is being tested. My concern is I have heard stories from nurses that some of the medical facilities are not doing this on their staff, and they have doctors that are actively infected. And what they're telling their staff is wear a mask, take your temperature 3 times a day, and if you get symptoms, go ahead. Go back home. That's scary, all right? As medical professionals, we owe it to the public and to ourselves that we test ourselves so we make sure we're not passing it to other people. So that's also critical. So this is a serious thing, guys. We will make it through this. Again, the healthier you are, the healthier you're treating your body, the better we have on the other end. If you're in an unhealthy situation, you're drinking, you're smoking, you're at high risk, it's more dangerous for you. So please stay safe out there. If you need extra advice, consultations, again, remember, we are doing telephone visits and telehealth, so then you don't have to be exposed to anybody. You can do it from home. So we are available for them. All right? So you guys take care.